Well, U.S. regulators have approved Pfizer's lower dose shot for children aged 5 to 11, and they could get shots into those young arms as early as this week. Dr. Dina, pediatrician and founder of Kid Crew, joins us live here this morning on CP24 Breakfast with what parents need to know and what we should be expecting here in Canada. Dr. Kulik, good to have you on the program again this morning. What do you make of this? The FDA has approved it for 5 to 11-year-olds in the U.S., so they could be rolling up their sleeves this week, potentially.
Yeah, so it has to go through CDC approval first, but they are meant to make a decision quite shortly. And then, yes, it'll be available for Americans starting in the next couple of weeks.
So I'm sure you'll be paying attention very closely. I mean, you're the founder of Kid Crew. This is sort of your business, as it were. What are you going to be looking for as this sort of unfolds in the U.S.?
Well, we want to see how many kids get it and how they roll it out. Will they do it within the pediatrician offices, as they say they will? They're also looking at mass vaccine clinics in schools and other places where kids go daily, and hopefully we can model the same here. Also, we've had very good vaccine success in Ontario and across Canada with mass clinics, so we'll be seeing if we can do the same thing for kids here once Health Canada approves it.
What are the big questions you're getting from parents at your clinics, Dr. Kulik?
A lot around safety and whether the vaccine was rushed or whether we are not seeing the side effects that maybe would be troubling for kids. But I want to reassure parents that Health Canada and the FDA and the CDC and all these groups are doing their due diligence. We would not be rolling out a vaccine that wasn't found to be safe and effective for kids. And there's no rush here. These mRNA vaccines have been studied for a long time, and they are safe, as we see in teenagers and in adults, and we wouldn't roll them out for kids unless they were safe.
Are you hearing anything, Dr. Kulik, about hesitancy after the province sort of unrolled its time frame, suggesting that, by spring or sometime in March, that perhaps, vaccine mandates and things like that may not necessarily be implemented as much? So are people sort of having second thoughts about, well, maybe I don't need to vaccinate my child because of what the province has said now?
I think a lot of people are happy they vaccinated their teenagers, and as adults, the vast majority of us have been vaccinated, which gives a lot of people comfort because we're seeing that our COVID rates are remaining quite low, quite stable for most of the country, save for some areas out west, and hospitalization rates are going down, death rates are going down, and kids and adults are living somewhat of a more normal life now with extracurriculars available and schools being open and people being able to go to restaurants and shopping malls, etc. So I think that confidence in terms of what's happened with teens and adult populations is going to translate to our kids and our families, our parents, how they're going to approach these vaccines.
And before I let you go, there is talk of some people suggesting, kids, they don't have an immunity to COVID, but people say, that the outcomes aren't as bad for young children. What do you say to people who pose that to you?
It's absolutely true. Kids have remained quite well throughout COVID. Very few kids need to be hospitalized. Even fewer die, which is fantastic. But they are absolutely impacted by COVID. There have been many people, about 2 million children in the U.S. that have gotten COVID. There have absolutely been some deaths. But I think more importantly, we want to make sure that as many kids as possible get vaccinated to provide that herd immunity, that more communicated community protection, and as well to get back to that more normal way of life, which we know is much more likely to occur if more of us get vaccinated, including our children. All
right, pediatrician and founder of Kids Crew, Dr. Dina Kulik, thanks for joining us here on CP24 Breakfast. Really appreciate this.